I'm a paediatric gastroenterologist. One of the main areas that I focus upon in terms of my research is inflammatory bowel disease. Inflammatory bowel disease is a condition that can begin at any age, right through childhood. Typically in children, this can lead to abdominal symptoms, diarrhea, pain, weight loss, and interruption of normal activities such as school and sports. We've shown that rates of inflammatory bowel disease, especially in Canterbury, have increased dramatically over the last few years, such that we're now at the top of the world polls, if you like, in terms of the rate of inflammatory bowel disease. We don't know the exact reasons for these changes. Some of the research that we've done supported by Cure Kids has shown that rates of inflammatory bowel disease differ across New Zealand. The further south one goes, the rates tend to be higher. Furthermore, some of the conditions that our children face, which can be directly related to social deprivation and poverty, include conditions that in many parts of the world are seen very infrequently, but unfortunately occur much more commonly in some of New Zealand's children. So my research has enabled a number of things, and that has certainly enabled differences in care and the approach to children with inflammatory bowel disease. My ongoing work has focused upon different tools that we can use for diagnosis, meaning that we can enable the child to suffer less prior to diagnosis and get on and manage and treat their condition much earlier. My research is very important because the conditions that I look at are things that are increasing quite dramatically in terms of the numbers of kids. They're incurable, and they can lead to lots of impact upon the child, their family, and not just in childhood, but right through the rest of their life as well. Eventually, I do hope to contribute to finding a cure for inflammatory bowel disease, but in the meantime, it's working on those other aspects. The capacity of Cure Kids to make a difference for children and for young people in New Zealand has been amazing over the last years. The impact has been impressive across a whole range of things. The support and funding from Cure Kids has enabled me to support, develop, mentor, and enable the early career of a number of other people. So some of the goals of child health in New Zealand include ensuring that our children, the New Zealanders of the future, thrive and prosper through childhood, and trying to overcome the adverse impacts of inequity and social deprivation and poverty upon our children. Although Cure Kids has a focus upon child health in New Zealand and is focused upon many different aspects of child health in New Zealand, many of the lessons that we learn in New Zealand have impact in other countries, including in the Pacific, but also other countries around the world as well.